Hello, board. Happy September. This is September 2nd as I record this, and I hope you all had a great Labor Day weekend. Hope you got to relax a little bit. I want to give you some updates on what's going on at Georgia Core. I know we just had our board meeting a few weeks ago, but wanted to give you just a few updates as we head into the month. First, Weird Looking Stools, our campaign for more awareness about the signs and symptoms of colorectal cancer, especially for early onset colorectal cancer. Some of the people have asking why are we focusing on early onset, because there's an expectation that by 2030 that colorectal cancer will be the largest cancer killer of people under 50 years old. And so this is something that we want to get ahead of, and have done it in an incredibly innovative way from chemistry, our design folks. So chemistry has been working with a PR firm on our behalf, and we are having a launch party September 15th, Monday, September 15th from 6 to 7:30 at Park Bar, which is in the State Farm Arena, Mercedes-Benz Stadium area of Atlanta. And if you haven't gotten information about that yet, we're happy to send it to you. And we're looking for sponsors for that and for around the state. So we have reached out to many of your employers as health care systems, hospitals, to see if they would be interested in us bringing stools to different areas of the state, having receptions at bars and coffee shops, and really promoting this. We're getting great response to the campaign itself, and really look forward to launching this and getting it going. We've been working on this a very long time. Great response, and we'll see what happens. So if you have questions, if you know of anyone who wants to sponsor, please let us know as soon as possible. And if you don't have the information yet about the event and you want to come, please let me or Christina know, and we'll send you everything that you need. We're excited about this, so thanks for all your support of what we've done so far. Some not so great news is we still haven't heard from the CDC. So you'll remember that we have applied again for a 5-year grant with the CDC to continue our colorectal cancer screening in Southwest and Southeast Georgia. We were supposed to hear something by August 30th. Funding was supposed to start August 30th, and we've not heard anything, and neither has anyone else. We talked to folks nationally. There are 34 states, who received this grant, and no one has received their notice of award. So we'll continue to watch for that. With the upheaval that happened at the CDC last week, we honestly have no idea when this might happen. So we'll let you know. Still waiting and hoping, but that has not materialized yet. So been out and about a lot, and will continue to be here this next month. We, of course, had GASCO annual meeting up in Alpharetta, and had a great C lecture on cardio-oncology. It went really well, and are grateful to Northside Hospital for all their help with that. We, of course, had the Georgia NCORE investigators and administrators, meeting up there at that time too, which was great. I went last week to the Prostate Cancer Roundtable and spoke to them, and all the good work they're doing for prostate cancer. Today, Emory University had a ribbon cutting on their prostate cancer screening bus that is going to be out and about all around Atlanta, and so that was nice to be there today to celebrate that. Also going to be, I was at the Georgia Life Sciences event that was up in Sandy Springs, and I moderated a panel on patient input into clinical trial design. And Dr. Guy Cantuaria, our former board member, was part of that panel, but that was a great day, and I recorded a podcast, and so I'll let you all know when that comes out. Also coming up is Health Connect South. That's a large health conference here in Atlanta, and that's on September 17th. And many of you, your systems, I bet, have bought tickets, and so if you want to come that day, let me know. But Dr. Steve McCune and I are going to be on a panel with Dr. Kristen Higgins from City of Hope, and so we'll be talking about women's cancer care. So that is happening. Also, several of us went down to visit a very small hospital in Southwest Georgia that's interested in starting the the process of being ready to have clinical trials. And so this was really interesting to us that they reached out to us, had heard we might be able to help, kind of tell them what they would need to do to be in the position to open cancer clinical trials. So we're very excited about the opportunity to go share our expertise and to help any hospitals in the state that want to get started with cancer clinical trials, to see how we can help advise them. We're not doing the work for them, we're simply advising them, but we think this could be a really interesting opportunity to start here and see about other small hospitals around the state and how we can help them get ready to be able to offer clinical trials to their patients. So that was a great one-day trip back and forth to Southwest Georgia. Also been out and about on the study committees. You know, the Cancer Care Access Study Committee is finished. We're waiting for that report. Have not gotten the draft yet. But there's also several others that all can have an impact on cancer care. And one is the cost and effects of smoking. If they recommend an increase in the tobacco tax, Georgia has the second lowest in the country. And also an increase in vaping taxes. Those are very low. And then also other measures to curb vaping amongst our youth. That can have a big impact on cancer-related activities if we can get some of that money funneled toward screening and prevention and other areas. Also, there is a committee on public health funding. We get our funds through the Department of Public Health, so that would impact us. There's one on internist, access to internal medicine in our rural areas for cancer screenings. That's a big deal, so really looking at that. And several others. There's one on insurance. So we're paying a lot of attention to these House study committees that are happening this summer. And then last thing I want to tell you is that we're having a staff retreat tomorrow. We really like to have twice a year, if we can, an opportunity just to have our staff for a day where we go through strategic planning initiatives and our systems. We have lots of new systems to try to improve what we're doing with our CRM and other project management systems. So we're going to be spending the day tomorrow really going over a lot just to help our staff. We are still in the process of hiring a administrative coordinator and have not pulled the switch on that yet. Waiting a little bit. We thought we had this CDC money wrapped up. We do not, and so we're just pushing the brakes a little bit just to make sure we have the funding that we need for that. So that is what is happening with us. As always, don't hesitate to give me a call. Let me know if you have any questions, any concerns about anything, and we will continue to keep you updated. We really hope to see all of you, at some of you at least, at our Weird Looking Stools campaign launch event on September 15th. And I think this is going to make a pretty big name for Georgia Core around the state, and we couldn't be more thankful to you for supporting our ideas and everything we do. So I'll talk to you all soon. Thank you. Bye.